This time is the presentation of the clinical clerkship illuminant, the topic of Barber's per management in goat farm at ด่านป้อมตี้กาญจนบุรี
Good morning, everyone. Our group is going to present about Barber power management in goat farm at ด่านป้อมตี้กาญจนบุรี Our group members are Isli, Kompon, Solavit, and me, Valanton. We found the problem in many goat farms at ด่านป้อมตี้กาญจนบุรี Their clinical signs are poor growth rate, low productivity, weight loss, and pale mucous membrane. On 15 November, female goat named Namtan with body weight of 30 kilograms had been sent to the hospital with both weakness and not found feces on 14 November. In this case, we didn't perform physical examination and treatment by ourselves. The veterinarian has performed physical examination and found lateral recumbency, pale mucous membrane, prolonged capillary refill time, and absent lumen contraction rate in 2 minutes. Fever, 7% dehydrated, and we found lowering abdominal distension, heart and diabetes. Haemonchus score is 4.5. Clinical signs of Namtan are depressed, weakness, growth, and fever. For treatment, they give intravascular fluid, 10% dextrose in saline, and guanosine metformin 1.1 milligram per kilogram intravenous route. The laboratory results show the abnormal but value they are neutrophilia, lymphopenia. We found high level of MCV, MCH, MCSC, low level of red blood cell, hemoglobin, thrombocytosis, and thalassemia is increased. But chemistry, we found creatinine is decreased and AST is increased. In physical examination, simple flotation technique found F of strong-side focus score. After the goat death, we did the necropsy and found protein exudate at trachea and parenchyma. When we cut a piece of lung for a floating test on water, there are zinc. It indicates the pneumonia. The most interesting thing we found in this necropsy is lot of bubble power in abomasum. This finding has a correlate to previous case. In 2 weeks previously, the veterinarian found 3 to 4 cases around this area death by Haemonchus that were confirmed by necropsy. So there are many Haemonchus cases in this area. It is better to know more about this parasite so that we can solve the problem. Haemonchus, contortus, or bubble power is gastrointestinal nematode. The goat infest with the worm when they glassing the larva state. The larva burrow into mucosa of both abomasum and develop to for larva state and adult form. The adult wormmate and product egg pass through feces. Egg hatch and develop into 3-level state in soil. When goat grazing, they infest the bubble power again. The diagnosis of Haemonchus contortus includes first clinical signs that separate to acute sign and chronic sign. Acute signs are mucous membrane submandibular edema. Chronic signs are weight loss, weakness, or muscle containness or lack. Second, Haemonchus score. Haemonchus system is a tool that matches the color of ocular mucous membrane that used to estimate the degree of anemia associated Barber worm infection in small ruminants by compared with a laminate color chart showing 5 categories. Category 1 is red and mucous membrane or not anemia. Category 5 is white mucous membrane or severe anemia. That the animal that should be treated Haemonchus should examine of 20% of herd in every 2 to 3 weeks. The last diagnosis tool of Haemonchus contortus is fecal examination. That is 5 techniques. Include modified mass matter test, simple flotation technique, morphology, culture of egg in fecal sample through the infective larva state, and fluorescent peanut agglutination test. Next, Mr. Kongkon will talk about treatment of haemonchus.
From the background knowledge, haemonchus will make the cold anemia, so the treatment method is similar to treating anemic patient. First, supportive treatment. Second, targeted supportive selective treatment. Third, anthelmintic treatment. For supportive treatment are composed of first, avoid making the animal stress. Second, fluid replacement may use lactate vinegar solution with delay depending on the severity of the animal. Third, multivitamin and all mineral preparation, intramuscularly or slow intravenous every 48 hours. Fourth, iron supplement as a precursor to promote red blood cell production. Fifth, high protein diet to compensate the protein loss due to parasitic infestation. And lastly, blood transfusion. Targeted selective treatment is the method that minimizes the use of anthelmintic so that the chance of anthelmintic resistance is decreased. Normally, in the groups of animals, parasites are not equally distributed. Only 20 to 30% of animals harbors most of the worms and are responsible for most of the eggs count. So treating only this part of the group with Haemonchus score 3 or above is sufficient. These are anthelmintics that have been approved for use in small ruminants. Before giving anthelmintics, don't forget to monitor fecal egg count so that you can compare the number of egg counts after treatment, whether it is effective or not. For the benzimidazole class, the resistance is most likely widespread among all of drugs in this class. For imidothiazole class such as lavamisole, there is less of resistance proven than benzimidazole. So it is better to use lavamisole. Next, prevention and control.
prevention and control should be considered. I will present you how to do that in this part. Farmer can prevent and control this parasite infestation by this method. They are using zero grazing system, do pasture management, and use alternative method. For zero grazing system, this system is the most aggressive strategy for eliminating the use of pasture. This way can reduce risk of exposure of infected larvae in the pasture. So, caretaker has to cut fresh herbage every day. When the caretaker cuts the foliage, they should cut at least 6 inches tall to reduce contamination of larvae with foliage because the infected larvae usually migrate 1 to 2 inches from the ground. For pasture management, rotational grazing technique is important and should be practiced when there is sufficient pasture area available. If pasture remains ungrazed for 2 to 3 months, it can be considered clean pasture because larvae have died off. According to this graph, survival rate of larvae decreased in high temperature. In Gr4 province, the temperature is around 25 to 30 degrees Celsius. So we suggest farmer rest at pasture for 2 to 3 months to reduce the number of infected larvae. The next method for pasture management is tilling the soil bearings. Some eggs and larvae will be exposed to heat and light, so this way can reduce the number of eggs and larvae in the pasture. Next, alternative method. Foliage containing condensed tannin, for example, in Thai called sadao, that have been shown to have a beneficial effect in reducing parasite load in small ruminants because it can reduce the hatch rate of eggs and appear to impair larval development. In addition, pharmacia examination should occur every 2 to 3 weeks, and herd fecal egg count should be monitored every 4 to 6 weeks. And selling the most chronically heavily parasite growth to reduce source of contamination in the pasture. Okay. Thank you for our advisor and thank you for your attention.
This group took 30 minutes for the presentation, and right now